Today we will be dealing about progesterone-only contraception. Progesterone-only contraception is given to women generally who have contraindications to estrogen. So in women where estrogen is contraindicated, there you have to give only progesterone. So wherever estrogen is contraindicated, there you give progesterone. So who are actually the WHO MEC category 4 for OCPs, COCs? Who are the patients in whom combined oral contraceptive cannot be given because estrogen is contraindicated? So there you have a mnemonic whereby we remember it with banks have various schemes to provide home loans during May. Okay, banks have various schemes to provide home loans during May. So this is the mnemonic by which you can remember. B stands for breast cancer. Basically, women who have breast cancer, in those women, it is contraindicated to give any kinds of estrogen because it will exacerbate the breast cancer. So in those women, you have to give progesterone only pill. Number two is patients have stands for hypertension, uncontrolled hypertension or hypertriglyceridemia. Hypertriglyceridemia is an indication for preventing for avoiding estrogen exposure. Various stands for unexplained vaginal bleeding. Unexplained vaginal bleeding. Whenever there is unexplained vaginal bleeding, it can be because of endometrial cancer, endometrial hyperplasia, and so in those women, we will not give estrogen. Here, progesterone is to be given. S stands for smoking. Smoking in women more than 10 cigarettes a day is an absolute contraindication, WHO MEC category 4. However, women who are smoking 1 to 10 cigarettes in a day are category 3 according to WHO. Smoking in women more than 35 years are an absolute contraindication to estrogen estrogen exposure, and so COCs are a complete contraindication. T stands for thrombosis. Women who have history of thrombosis, in them also estrogen is preferably not given, OC pills are not given. P stands for pregnancy. Any kind of diagnosed pregnancy or UPT positive is of course is a complete contraindication to this thing. Okay. H stands for your there are two H basically. Okay, so both the H I have written together. One stands for hypertension and the other stands for hypertriglyceridemia. Okay, L stands for liver disorders. Okay, so all the liver disorders like hepatitis or any kinds of liver disorders are contraindication for OC pills because they will exacerbate the cholestasis. Okay. D stands for diabetes mellitus with vasculopathy. Remember, whenever there is vasculopathy, then only your COCs are contraindicated. Diabetes mellitus with vasculopathy. While only diabetes mellitus without vasculopathy is not a contraindication for OC pills. And M stands for migraine with aura. Okay, so migraine with aura is also a complete contraindication for giving OC pills. Okay, so these are the complete contraindications. So these are the women in whom you have to preferably give progesterone only contraception. Progesterone only contraception is given to these women who are having contraindications to estrogen. Progesterone only contraception is given. Okay, so what are the options that you have in progesterone only contraception? You can have oral methods of progesterone. Okay, so progesterone only pill, that is your POPs are one of the option. Then you have injectable progesterone contraception. Injectable progesterone contraception, injectable route is there. Then you have implants. Contraceptive implants are also there, which have only progesterone. and also you have some miscellaneous other groups. So basically we are dividing progesterone contraception into three main categories. One is progesterone only pill, then your injectables, and then comes your implants. So first let us talk about POPs. Okay, so progesterone only pill, POP. So what are POPs? POPs are actually the tablets which contain lesser dose. They have lesser dose of progestin. They have lesser dose of progestin. I have already spoken progesterone have four generations of progesterone. Apart from that, you have some synthetic progestins also. Synthetic progestins which are available. Synthetic progestins are also available. Okay, so lesser dose of progesterone tablets can be given, not very higher dose. Of course, higher dose of progesterone. Here, I want to mention one thing. Very higher dose of progesterone, higher dose of progestin is used in emergency contraception. It is used in emergency contraception. Remember this. Higher dose of progestin is used for emergency contraception. That is, which one do we use? We use levonorgestrel 1.5 mg. 1.5 mg is used, or two doses of 0.75 mg, two tablets 12 hours apart can be given. This is very high dose progesterone. Lesser dose of progesterone can be given, like 150 micrograms tablets can be given for women who are wanting POPs. Okay, so if you are giving a prolonged progesterone tablet every day you are giving, then you have to give lower dosage. Otherwise, there will be very much higher concentration of water retention in the body, which will lead to headache. Okay, breast tingling, breast numbness, weight gain. These all things will happen if you give prolonged exposure of progesterone for a long time. So you have to give progesterone in shorter, smaller doses. But if you give a higher dose of progesterone at one go, it will also lead to implantation, lack of implantation. But then in that case, you cannot give it permanently. You have to give temporarily, which is why emergency contraception is not a routine method of contraception. It is just for the time being that emergency contraception is given.